Alright, I chose to do my PowerPoint and my presentation on meningitis. I chose this topic because I remember going over this disease when we were doing the brain and the spinal cord, and it kind of interested me, and I remember Dr. Watts touching on meningitis but not really going into too much detail, so I kind of wanted to do some research on my own and figure out more about what it was and the causes and treatments and who it really affects and stuff like that. So um, basically I'm just gonna touch on some of that. So the topic is meningitis by TMUs, and get into what really is meningitis. So, to put it simply, meningitis is inflammation of the meninges, and to understand what that is, you have to know what the meninges is. The meninges is essentially a protective covering that covers the whole brain all the way down to the spinal cord. Um, there's three separate layers of the meninges. The outermost layer would be the dura mater, followed by the arachnoid matter, and the inner layer would be the pia mater. So what this does, it really just protects your brain and your spinal cord from getting infections and bacteria and things getting in, because like if you're a baby or something like that, you don't really have your skull, it's not fused together, so things could penetrate through the skin and get into your brain, like from washing your hair and stuff like that, or water when there's a little baby and their skull hasn't fused completely together. So it's just pretty much just a protective barrier for your brain and spinal cord. So meningitis is inflammation of the meninges. Let's see. Next, we're going to get into the causes of meningitis. There are three main types of meningitis. You have bacterial, viral, and fungal meningitis. The bacterial meningitis is caused by a bacteria entering the meninges through the bloodstream, or possibly from actually getting into it. Say you have a skull surgery, or through your sinuses, or something along those lines, a skull fracture, things like that. Not very common, but it is very severe if you do contract bacterial meningitis. Next, we have the fungal meningitis, which is caused by a fungal infection. It cannot be passed from person to person. It typically is caused in people that have an autoimmune deficiency, such as AIDS. So it's not very common at all. And then we have the viral infection, which is very common. That's the one that most people get when you hear of someone having meningitis. It's typically viral meningitis, which can be caused by a virus such as herpes simplex, HIV, mumps, and other viruses like that. Other forms of meningitis, which aren't very common, could be caused from medication, cancer, and drug allergies. So those are just some extra types. Who's really affected by meningitis is the next topic. Anyone that has a meninges can get meningitis, basically, but it's more common in people under 20. Bacterial meningitis is common in people under 20 years old. Children under 5 are more likely to get viral meningitis, and if you living in a community when they're close to people, that could cause you to get meningitis, as well as women who are pregnant, because when you're pregnant, you have a higher chance to get a disease called listeriosis, which leads to meningitis. AIDS and other autoimmunodeficiency diseases, you're more likely to get meningitis if you have that, which I touched previously. Skipping vaccines as well, so missing vaccines can cause them. And we're going to touch on treatments. On this slide, I was going to get into more common, which I already discussed, was the viral. Viral meningitis is very common and typically resolves itself. You don't really need any extra treatment, but fluids and bed rest are very well for viral meningitis. It normally clears up, so it's not that serious. And then we have bacterial meningitis is very severe. It's very severe, and antibiotics are needed to treat this. It could be fatal, and sometimes the doctor will drain the sinuses if you have bacterial meningitis. Fungal meningitis is not common at all. It's very rare, and is treated with antifungal medicine if you have that, but it's not common to get that. So anyways, that's that. And this is my reference page. I'm not sure if you can see it very well. There we go. This is also in my paper, the same thing, the same reference page. I know it's very hard to see because it's bright in this room, but these are the sources I used, different websites, the Mayo Clinic, WebMD, and the Center for Disease Control. All right.